to the Crossing Borders podcast. I'm your host, Julie White. On this show, my guests and I share information to help foreign-trained health providers find their way into meaningful careers in the Canadian healthcare system. Let's get started. Welcome back, everyone, to the Crossing Borders podcast. I am so excited to have you with us today. We have a fantastic guest. Megan Bailey is joining us. Megan is a professor of health information management in Kingston, Ontario. She's also a PhD student in health informatics at the University of Victoria, and I'm sure she's going to talk to us a little bit about that. I am totally geeking out today on today's episode. I'm a little bit afraid of data, but Meg is going to have us all talking data and data careers, I'm sure, by the end of our podcast. So welcome, Meg.
Thank you very much for having me, Julie. I appreciate just the opportunity to speak more about health information management.
Excellent. All right. So there's all kinds of careers, and your area is one of the growing professions really in healthcare. It's been around for a while, but it's really growing. Can you talk to me a little bit about that?
Yeah, so it's actually interesting. Some of my colleagues at the University of Victoria, two of my professors, they actually just published a new study about careers in health information management and health informatics. It's kind of separate, but related. We're actually the fourth largest healthcare workforce in Canada. So it's interesting because they had to comb through all these different documents to find the actual numbers, because we as a cohort or a career group, we don't really have the best data because we're really still emerging and solidifying ourselves as Canada kind of embraces more of the information and communication technologies to support healthcare. But they found all this information and it goes nurses, doctors, social work, then us. And I was just absolutely astounded that we were number 4. So yeah, lots of jobs and even more jobs that are still emerging as we continue on our journey of creating more electronic or digital health information.
And it's a profession that's really been growing over the last decade, probably, hasn't it?
Yeah. So just a little bit of history for those of you who don't maybe aren't aware. But in the early 2000s, there were a few different reports that were made about the Canadian healthcare system and what we needed to do in the Canadian healthcare system to advance and to ensure that we had sustainable healthcare as a publicly funded system. And one of them was embracing information communication technology. So, those reports were in the early 2000s, which is really only about 20 years ago. And if you haven't been here in Canada long, things in the government take quite a while to come to fruition. So, right now, even here locally, I left our regional health planning authority that Julie worked at before I worked at. I left there 9 years ago. 9 years ago. In 2015, 2016, I left to come to the college full time. And we are now just seeing the evidence of a project I worked on actually be implemented, the Lumio project. I was on the RFP team developing that back at the Lynn, Southeast Lynn, when it first came out. And now we're finally going to implement this in late December. So,
Can you tell us a little bit about what Lumio is, just for folks that aren't in the area?
So right now we have 6 main hospital institutions. So we have Kingston Health Sciences, which is Hotel Dieu Hospital and Kingston General Hospital. We have Providence Care Hospital. We have Perth Smiths Falls District Hospital. So the sites of both Perth and Smiths Falls. We have Quinte Healthcare Corporation, which consists of 4 hospitals: Trenton, Belleville, Picton, and Bancroft. We have Brockville General Hospital as well. So all of those organizations have separate, different information systems called hospital information systems, or HIS. They can also be called patient care systems, just depending on which logo or jargon you're using. The proper term is electronic patient record. But all 6 institutions are coming on board, and we're all going to be on the same system. Oh, I forgot Lennox and Addington County General Hospital. They had a separate one too. So, we're amalgamating 6 different hospitals to move them onto one single electronic health record system for the community. So this will mean better sharing of information across multiple different hospital sites, which is important because we have really small institutions like Lennox and Addington, and then we have really large institutions like Kingston General Hospital.
Good. And when we start to talk about health information management and the types of careers that are available, I know right now we're talking about the health information record, but can you give me a little bit of a sampling of the types of roles that you're talking about that students from your program would certainly be working in?
Yeah, so I'm going to focus on health information management more specifically. So health informatics is the broader term, right? So it's talking about anything related to health information. So that could be the technological side or the information side. I focus on the information side. So the data that actually exists within the electronic health record, that's where my focus is. So in health information management, the first kind of jobs that you will get out of graduation from any program are typically working in a records department. So the clinical records department, the health information department, medical records, it can be called a variety of different things. But this is where we keep the business record of the institution. So healthcare is a service. When you go to the healthcare institution, whether it's primary care or hospital care, they need to have a business record of what occurred, what services they provided to you, because this is really a business that they are reimbursed from either private insurance or from the provincial or federal governments. So in this instance, you will work in those areas, either working on, managing the record, ensuring that the record's available, looking at the quality of the documentation in the record for improvement processes. And then you may start working in what we call clinical coding and classification. So when you go to a hospital, you might have seen people documenting on a piece of paper or in an electronic record through a computer. That information is all there. And there's a lot of information that is collected. But when we look through all of that record, we have to be aware that we need to export that information and look at it through a different lens. We might need to use it for planning purposes or for education purposes or for research or for financial reimbursement. There's a variety of different reasons why we could use it. We could also use it for legal purposes, in the defense in a lawsuit for malpractice. So quality information is vitally important for the care of patients, but also for the operation of an institution and for the planning, managing, and funding of that institution as well. So those are your first kind of introductory jobs, but clinical coding and classification takes certain parts that are important from that record and abstracts them, takes a subset of that data and provides that information to provincial governments and also national institutions so that we can have information for these planning purposes and coordination of healthcare services here in Canada. So that information is what we use. It's called clinical coding and classification because we actually take clinical information and we use codes to classify that information so that we can group certain different types of patients together so that we can understand how much services those patients use, how much those services may cost, and what are the trends in providing those services. Do we need to offer more geriatric services in Kingston, or do we seem to be having an increase in younger patients coming through? Are there more babies being born here? And so we need to increase our maternity wards. Those are the types of information. So that's maybe more of like an entry level to intermediate job. There are people that work in coding all their lives. Next, you would move on to what's called clinical documentation improvement, where you would have a very good understanding of the clinical background. This is an excellent opportunity for internationally educated medical graduates to work there, because you've worked as a clinician in your home country, and now you have an opportunity to share that knowledge here. And so what we're doing here is we're actually starting to optimize the documentation so that it reduces the amount of time we spend on writing that documentation, and we spend more time providing direct patient care. We also make sure that it's, meeting some of the standards that we use for things like financial reimbursement. If we forget to write stuff down, and there's very common things that we forget to write down or make linkages to, the clinical coders can't actually code the episode of care properly. And this can result in decreases in funding, primarily to institutions, or poor service planning for that institution. So I always give the good example of somebody who's come in for an operation within the hospital, and maybe during their episode of care, they develop pneumonia. And so a post-admission pneumonia can be treated in multiple different ways. And it also depends on the type of pneumonia that a patient would have, whether it's viral or bacterial. Bacterial pneumonia is treated much differently than viral pneumonia, because we have to assign antibiotics, and there could be complications with those antibiotics. So in that case, if the doctor, because the doctors, they have the entire record to look at, if they read the documents, like the lab results, and they see that it's bacterial pneumonia, they have to actually write in the documentation for the coders, pneumonia due to bacterial infection, so that we can actually classify it correctly, because we can't actually interpret, because we're not clinical experts, the medical lab reports. That's not really allowed, because it's only a physician can make a diagnosis, if that makes sense. So that's more getting advanced. On the opposite end, you could maybe not even work on inputting data. You could work on taking data out. You could work in analytics, which is primarily what I did. I worked in the knowledge management and data coordination, and a little bit of epidemiology. So looking at trends and patterns in healthcare services and how sick our local population was. So on that end, what you're doing is you're using all your knowledge that you gained to pull data out correctly and to answer questions. So we can use the codes, and knowing those codes, which codes to pull out of the data sets, so that you can have a good understanding of what's happening within your population. You can tweak the information so that you're getting as specific of answers as you could possibly need. The data analytics is a big area where a lot of our students are going into, especially in case costing, because our professors here at St. Lawrence College actually have a good understanding of case costing from their previous work. We've hired some amazing professors here that understand the concepts. After that, I still have more, because it's such a diverse field. There's also privacy. So privacy in Canada, your personal health information is your personal information, and you have the right to have that information that you hand over to an institution kept confidential. So we kind of see it as a balancing act. You have the right to privacy, but an organization has an obligation to keep and maintain confidentiality. So in privacy, we look at a few different jobs in there. So, your beginning roles will be in what we call release of information. So releasing patient records to the patient, maybe to another healthcare provider, or to a legal team, if that's why they've requested it, maybe to a health insurance company, or workers' compensation boards, or a variety of different reasons why you can request your medical information to be handed over. The other end is looking at auditing. So making sure that people aren't accessing people's information when they shouldn't be. Unless you provided direct patient care, you shouldn't be accessing a patient's personal record level information. You need to be looking at it in an aggregate, or for a very specific purpose, like maybe infection control. So auditing becomes like the second level in the privacy realm. And then in a higher level, what you'll be doing is you'll actually start doing what's called privacy impact assessments or threat risk assessments, where if you bring on a new technology or a new protocol or a new tool, what you're actually looking at is how does that new service or product or pathway influence or impact the privacy and the obligation that you have to maintain confidentiality of that person's personal information. So those are the privacy careers. Then we can also get into quality improvement. We've talked a little bit about it in clinical documentation improvement, but we're also seeing a lot of it in health quality improvement. So using data to make better decisions about providing better levels of care. So what surgeries are leading to more risky hygiene outcomes or infection rates, or maybe even looking at issues with certain types of surgical tape. That one's my favorite one. Is there was a study done at the Otto Hospital where all they had to do was change the tape, just a different supplier. Babies get rashes from different diapers, and so nurses have like very specific combinations of like diapers and rash creams, and you can see like an increase in diaper rash if you change one or the other. So you can see all this information and how it changes things. So lots of different careers in health information management.
And you're talking about them largely in hospitals, but where else will we find them, Meg?
So primary care has become a really big area, especially with the change in Ontario to Ontario health teams. We're seeing more people working in like digital health sort of areas and working on how do we leverage the information that we have within our electronic medical record to have better healthcare services and outcomes. So how can we maybe look at the Ontario billing codes that primary care physicians use to optimize patient care, but also to maybe send reminders that, you know, you need a flu shot. If you are a smoker, you can have multiple smoking cessation check-ins and counselings through there. So what we do is we build in reminders to the clinical staff team, and then our administrative staff can work to book people in on a more regular basis. Introducing technology a lot in primary healthcare. You can also work, especially in decision support and analytics, in health policy, the Canadian Institute for Health Information, public health. We have a few students who work over in public health on a variety of different teams over there. But home care in our community is a big area too, where HIM professionals work, because there's a lot of coordination between the different people. So your primary care, your hospitals, and your home care services for what supports are needed in the community. So lots of different areas. I also have students working, like I found out that one of my students is now like a privacy lead at TELUS Health. That was pretty cool. Ontario government, Ministry of Health. I've got a few former students over there. I have a student or a former student who is like our national lead for cancer coding at Statistics Canada. Like she is the person in charge of cancer coding for Canada. And I was like blown away when she showed me this job. I have another student who works for the Canadian Medical Protectorate Association. So that's almost like the legal insurance company for physicians in Canada. And she's an analyst that reviews and makes notes about upcoming court cases. She came from Law and Justice Canada. She came into this program just for a fresh start and wanted to get more into medical legal issues. And yeah, she's got a cool job too. I have lots of cool stories from students that are just like, oh, I found this job and I think it's cool. I'm like, yeah, that is cool.
It is really interesting. And you guys work on a lot of really wicked problems in the healthcare system as well.
Yeah. So when you're going to solve a problem, you need to have evidence to support whatever decision making that you're going to do. And it's funny when you talked about like, oh, you'll give a little bit of your background. So when you're making business decisions, which healthcare is a business, you have to have that background in understanding how to make tough decisions and using evidence to support your decision making and justifying the decisions that you made with, realistic, tangible understanding so that you can justify why you did something in a certain way. Because basically you always have to prove yourself why you did something to somebody in the government system.
Right. And that's great. And you were working at a higher than entry level role, clearly, at the time. So not everybody needs to go to university, but
no, but like, it's funny because I actually started. So if we go back on my education journey, I have a really eclectic background. My undergrad degree, I originally was going to be a high school teacher. I was at Queen's Trent for concurrent education, which is this program where you do some of your Queen's courses for your Bachelor of Education at the same time that you do your undergrad degree. And I thought for sure, like, I'm going to be a high school biology and geography teacher. That's what I was going to do. But I met an amazing professor, Professor Raul Ponce Hernandez, and he taught me about information systems, and it just kind of clicked for me. So I had all this experience working in information systems. I worked for the Ministry of Natural Resources. I worked for the United Nations Food and Agriculture Organization on a special project in northeastern Mexico. I had all these really great opportunities provided to me through my undergraduate degree that, unfortunately, in government work, it's a lot of contract work. And I lost my contract, or I didn't get renewed. I shouldn't say I lost it. I wasn't renewed. And I decided to go back to college because I'd found this program, Health Information Management. I was like, well, they don't cut healthcare in Canada. Let's try this instead. And I actually went, after graduating, I begged them to let me into the LIN to do my placement for my program, Health Information Management. I'm a graduate of the program that I now coordinate in. And that gave me the opportunity to start. And I actually started as a project assistant. Like, I was basically the administrative assistant for my unit. And then I got bored really easily because I could do additional things. So I offered to do additional work. And then that led them to reclassifying my job. And then when somebody went on maternity leave, they said, well, let's just let Meg try, this maternity leave. And sure enough, I just kept on moving up and up and up. But no, Julie, I actually didn't start at a higher level. I started as like the administrative assistant for that team. And it was just me trying that I got to do more things and asking for additional work. So no, you don't have to go to university. I could have just gone to college, but I asked to do more. And I think that that's an important thing for new grads anywhere is show up, be present, and offer to help.
And that's exactly what we find with our healthcare admin students as well. You get your toe in the door somewhere, you start to prove yourself, and you will move up quickly, probably, as long as you're doing the work and you're showing the skills and you're reaching for more. So that's one of the things that I'd like to talk to you a little bit about. Anybody who's interested in getting into health information management, do they need to take a full program? Is there something that they can do to test to see if this is potentially an area that they may have interest in? And what kinds of skills kind of does that typical candidate have?
So to actually become, so ours is a certified profession. So you do have to graduate from an accredited program to become a certified health information management professional. No, you don't have to. However, in a lot of places now, they're demanding the certification. You can take it part-time. You could take 1 or 2 courses to see whether or not you like it. But reality is that you're probably going to need your certification. You could try doing some, just general analytics courses online. There's some great free resources through, Udemy and Coursera that you can take a look at. DataCamp is a good one too if you that one's a little bit pricey, but it's a great opportunity to see whether or not you have the patience and temperament to work with data.
All right. And what kind of person does it take to want to work with data and to be satisfied in a health information management career?
So you have to have the technical expertise, as well as the analytical skills. You have to be able to pay attention to detail. You need to be able to solve problems and look at problems from multiple different angles. You have to be adaptable because things change all the time. You have to have good communication skills. And the reason why you need to have good communication skills is that sometimes you're explaining very complex concepts and you're using data and numbers to explain why and to justify decision making. And sometimes you're explaining these to a board. Like a lot of my presentations are always to boards of directors. And in those boards of directors, they're just general people from the community that have been appointed to these boards of directors. They're not experts. They don't know this information. So you have to find a way to bring it down to a level that everybody in the room is going to understand. And so you need to also be able to read the room. Best person in the entire world who could do that, Don McGuinness, former colleague of Julie's. He is the most down-to-earth, calm person to be able to explain information and show and tell a story, because that is really important in health information management, especially if you're in that analytics. But even the communication skills with release of information, like that's a customer service position. You may be speaking to a family who's looking for information about a deceased loved one, or a person who's really upset with the care that they were provided and they are suing the institution and they want a copy of their record to give it to their legal team. You know, those are some sensitive topics that you need to handle and deal with. So those communication skills are really important too.
Excellent. You had mentioned you need to have certification, and you can get that through one of the certified programs like the Health Information Management program at St. Lawrence College. How does that certification work? Do you just take the program and you're automatically certified?
No, so you take the program and then you write what's called the National Certification Exam. So your National Certification Exam is after you graduate from the program and you have your transcripts, you apply to take your examination, and you take your examination just like many international medical graduates would have taken to get their licenses. We're not a regulated profession, but we maintain the same standards as a regulated profession. Because we don't directly deal with patient care, it's not the same. But it's regulated in the sense that you have to follow a code of ethics. Like most clinical groups, you have to pass an examination and you have to maintain your professional status through continuing professional education.
Okay. And that's done through a group called CHIMA?
Yeah, so that's the Canadian Health Information Management Association and the Canadian College of Health Information Management.
Okay. And there's also a Health Information Certified Associate license, right?
Yeah, so that's a newer one that's come out. It's meant to be an introductory to the profession. What we're seeing right now is a lot of work is kind of being muddied between medical offices, administrative staff, and like the HIM staff. And so what they were trying to do, and what they are doing, is they're trying to provide more leveling within the profession without diluting the knowledge of the upper levels. So, you know, in the US, there's like multiple different certifications you could get, but here in Canada, there's a few different ones. But the HICA one is only been around for about 2 years now. So it's relatively new.
All right, excellent. And in terms of where the profession is going, what's next? Like, where do you have kind of a crystal ball in terms of what's down the line? I know we're talking a lot about AI and healthcare, and it's all about data, and it's going to be the savior of this and the savior of that. But what do you see, Meg?
So it's interesting. So clinical coding and classification was something that I never really enjoyed doing, because what you do is you read through a patient record and then you find out all the diagnoses and all the interventions or procedures that were done on that patient, and you translate them into codes. And even back in 2013, with my knowledge of information systems and automation and modeling from my work with the United Nations, I was like, this could be automated. Well, here I am pursuing my PhD, looking at automation and clinical coding, and how we can use computer-assisted coding. And the reality is that there's a lot to do within the data, and we don't actually have data that we can use to train models. The best model that's being used right now, or the best data set that's being used right now to train systems, is based out of the US, and it's called the MIMIC dataset. And it's from an institution in Massachusetts, which is very different from the, areas that we experience here in Canada. Like, the population makeup is very different. And so we can't really use data that doesn't truly represent a population to train models. So there's a lot still to be done. And so what you're seeing right now is you see a lot of individual institutions applying AI techniques to their own data within their own institution, and seeing what they can see there. But there's not a lot of cross sharing. There's some, but there's not a lot of cross sharing across multiple institutions. St. Michael's in Toronto, Unity Health, they're doing a lot in the AI space with the University of Toronto. And Queen's is exploring more with their Center for Health Innovation. But the problem is right now is that the majority of Canada still works in paper records. So you can't really be using all these tools when you still have a significant amount of information in, a paper format. Like, it just doesn't work. So right now, that is to say that all my students are always scared that AI is going to come out and replace this main job set called clinical coding and classification. And my research so far has shown that we're not even close. Like, it doesn't get specific enough, and you can't have the recall and the precision that's good enough to rely on it. Most people are still operating in what's called a centaur method. So it's like a hybrid where you use the AI to improve the output of the human performance. So the AI is like the horse legs, and like the human is still like the human part of the centaur. That's making sure that it's going in the right direction and can steer it the way that it needs to be steered.
I think that's probably a fair description of pretty much anything related to AI is that we still need to have that human element in terms of many parts of the process. In terms of kind of developing those AI pieces, is that something that health information managers get into? Is there kind of a component of your profession that involves AI?
Yeah, they can. Right now, the focus for our AI will be the data and the quality of the data, to make sure that the data is accurate and timely and useful and coherent, right? So we're using those data quality indicators to make sure that we actually have good quality data in which to train models like AI tools. So we're focusing there. And then we're also focusing on what's called clinical documentation improvement, because a lot of times, as I was previously explaining with that pneumonia example, we don't have all the information in all the right spots. And it's really hard for us to get the information into the, nice, tight, concise ways that the AI wants to consume it in. So we focus a lot on what's called data engineering. So we focus on ensuring that the data is there through the pipelines to feed into the system. Some people may go more on the data science side, but a lot of times we're focusing more on the data engineering components.
Okay, good. So once you kind of get into a career in HIM, there's many different places that you can kind of branch off and go and explore as well. So even if you kind of enter as a coder, there's probably somewhere that you're going to be in 5 years or in 10 years doing something different anyhow, right?
Yeah, the Canadian Health Information Management Association has this nice career matrix tool that you can actually see that what they've done is like entry level 1 to 3 years, 3 to 5 years, 5 to 10 years, more than 10 years of experience, and they show a laddering system that you can move into, and they also show the skills or the further education that you're going to need to get there. We've got a lot to do. There's only 2 bachelor's degrees that are specific to health information management in Canada. There's only 1 master's program. Everything else is like this broader health informatics lens that, you have to be specific and focus on information management within the health informatics realm. So, there's a long way to go. And so I think it's still an amazing opportunity. I just wish that somebody had told me about this when I was in high school, because I was always good at statistics and accounting. Like, why didn't somebody say, hey, why don't you try this instead of going to teachers college when there's no jobs for teachers when you graduated from school?
Well, now you've brought it full circle.
Yeah, exactly. Now I'm a teacher. I mean, there's no such thing as bad education or, a waste of education, but I just think about how college needs to be more in the conversation than university. First of all, like, compare college tuition to university tuition, see how much money you save. And then that's another thing, right? College, and especially HIM, right? It's a good return on investment. I like, so many of my students are getting jobs and getting jobs quickly. And so I'm really proud of that, right? Is that my students see, like, they come in, they see the jobs, they start applying for jobs, they go on placements. That's a big thing. Their placements is absolutely key to their success. And in fact, we try to tell students, like, BC is hiring and they'll take you on placement. You need to go to BC. We have a student in Prince Edward Island. We're like, you should go to Prince Edward Island. They're like, well, will I get a job? So we asked. They're like, oh yeah, if she comes, we'll give her a job. So she got paid to be on placement.
That's crazy.
Yeah.
And how many colleges really have an accredited program like you?
So it's right now, I think there's 17 across Canada, but that's colleges, universities, and private institutions. So like career colleges. In Ontario, there's only 3 public colleges, us, George Brown, and Fleming, that have the program. DHA Learning, which is like the original, they started it because this profession actually used to be like, you were hired to do the job and they trained you almost like an apprenticeship. And then in the early 2000s, when this emerged as a college program, St. Lawrence College was one of the first ones. We started in 2004.
And your program is a 2 years, 18 months. Do you have a summer break?
Depends on when you come in. So we have 3 intakes. If you come in September, you'll have a 4-month break. If you come in May, you'll have a 4-month break. If you come in January, you'll go 16 months straight.
Okay. Well, that's interesting. And if anybody has any questions about it, obviously you are the program coordinator, so they can reach out to you. In terms of what you do, Megan, and I know you're after your doctorate right now, so you're going to be Dr. Bailey eventually. That's
Hopefully.
So cool. It's got such a great ring to it.
It's funny. One of my colleagues, he always called me Dr. Meg. And I always thought it was funny because I was like, I'm not doing it. I'm never going to do a PhD. And now I'm doing my PhD. And I saw him the other day and I like hung my head down and he's like, Gina told me that you're doing your PhD. And I was laughing at him. Yes,
That's
he's like,
awesome.
you are going to be Dr. Meg. Yes, I guess so.
And you're doing this from that role where you started as the admin assistant. So
Yeah, that's how I knew
that's,
him.
that's pretty
And I
amazing.
think that he thought it was funny uh, that he would call me Dr. Meg.
Yeah.
And now I just laugh when I see him at certain events. Like, yes,
That's
I'm going to be a
awesome. That's
doctor now.
absolutely awesome. So
Yeah.
what's next for you? What is it that where do you want to apply your PhD, or is that something I probably shouldn't be asking you?
No, so my area is on, so I've been focusing on clinical coding and classification, AI, how AI is going to affect my profession. And I think that's really important. It's mostly going to be in change management. So I've got a potential project with the Ottawa Hospital and working with them because they actually use the computer assisted coding system, but some people can turn it off, some people don't use it, some people don't think it's correct. So I think that I'll probably do some work in, implementation science and change management. I think that's where I'm focusing in on. I would love, love, love to, with this new regional Lumio system, develop the Canadian Mimic, as I called it. That's that data set that's based out of Massachusetts from Massachusetts Institute of Technology, MIT. I would like to do that with Queen's, and I've got some friends over at Queen's in the computer science program that I keep on bugging them and saying, I want to do this. I want to do this. So I think that's where I'll be going, is doing some projects and hopefully having opportunities for some of my students to join me along the way and help me. We just did a cool one with Kingston, Frontenac, Lennox, and Addington, and getting our students to recode and to translate from multiple different data sets and almost create a data map between different versions of the International Classification of Diseases and Health Related Problems. So that's like early warning detection systems to see when we're going to see our next pandemic.
Wow, that's really cool.
Mm-hmm. Yeah.
And research is a big part of the work that you're doing as well, right?
Yeah. I just actually submitted a REB application here locally to see whether or not we can have a new minimum data, a new entry to practice for clinical coding and classification standards came out from the Canadian College of Health Information Management. And so what I offered to do was to actually get the people working in those positions to participate in a research study to say, okay, we're going to actually survey them and say, what are the minimum standards? And we're going to go body system by body system and ask them to report on, here's what the standards say. What is your opinion? Should this be taught at an entry level, or is this more in an advanced case? Like, what are the actual entry to practice standards that we need students to be able to demonstrate? And from there, can we develop almost like a portfolio of patient cases that every student in Canada is trained on so that we can produce a really good quality workforce?
That's really cool.
Yeah.
Love how you're pulling kind of both of your worlds together too in order to do that. That's awesome. Another
Hopefully.
full circle moment with Meg.
I know. I just keep on thinking about different things. And I've been really grateful this year that we've gotten some new faculty who are really amazing. One's a former student of mine, and one is one of the first graduates from the HIM program here at St. Lawrence College. And they're now working with me, and they're just amazing women, and they can do so much. And so because of that, we have so many opportunities left for us in the future.
That's cool. And you've got an international intake as well.
We have mostly international students. We're about a 70-30 split. Almost every cohort is 70% international.
All right. And do you take students directly out of kind of high school?
Yep. About 30% of our students are either direct from high school, Canadian Ontarian students. They are mature students. So they're people that may have been in the workforce, a PSW who's been injured at work, or a person who's moved with their military family to the Kingston region, or somebody who might have been laid off from their job. And so they're kind of starting this as a second career. That's where a lot of our students come from. But we do definitely get some direct from high school students. We get direct from high school students that are absolutely amazing, either from, India or Nepal, or my last direct from high school Indian student was employed first before any of their colleagues in their cohort. They said that they wanted to go to Cornwall. Cornwall was hiring, and so we put them on placement in Cornwall, and they just loved her.
You mentioned that it's a good return on investment. What does a kind of a starting salary look like for somebody in HIM?
So starting salary, so we typically, because they're unionized positions, they're normally hourly wages. So you're working about 37 and a half hours a week. And in this region, we're a little bit less. We're at about 27 to $32 an hour. And it just depends on like your union, your intake that you're in. So like a small community like Napanee might pay less than like Kingston because of cost of living. In Alberta, BC, they're up in the $40 an hour. Like they are paying a lot, although cost of living there is much higher. However, if you go to interior BC, cost of living is very low, but you still get $40 an hour. So really good hourly wages. And that's mostly for like clinical coding classification. Decision support analytics, you're in the, $80,000 to $90,000 range a year because they're more salaried positions.
And that's starting. Yeah.
Yeah. Like we all joked around about the fact that I took a pay cut to come to the college.
Yeah. It's not a joke.
No, it's not a joke.
The pain is real.
The pain is real. But, I think that there is more to a position than just salary. Like I think about, all the people that I get to help and how I get to help my industry by ensuring that we have good quality graduates coming out of the program.
Okay, thank you so much, Meg, for joining us. It's been fantastic learning from you today. Thanks so much for tuning in. I hope the information shared today helps you in your journey. If you haven't already, be sure to subscribe to Crossing Borders on Spotify, iTunes, or wherever you get your podcasts. And if you're so inclined, rate this show or provide feedback in the comments. You can always find more information at profjulie.ca.